This is Haiti Merritt with Insulin Nation. We're here at the Joslin Diabetes Innovation Summit 2012 here in Arlington, Virginia. And I'm here with Deneen Vojta.
Yes.
Hi, Deneen.
Good morning.
Thanks for joining us.
Thanks for having me.
Sure. What is your greatest aspiration in combining technology and healthcare?
The good news is that healthcare and technology are increasingly coming together. We at United Healthcare for 2 decades have been focused on helping consumers take responsibility and control over their health and health care. And certainly it looks like technology is enabling that. And as it relates to the healthcare system, technology is absolutely, it brings the hope of the triple aim. So improving access, improving affordability, and of course improving health outcomes.
That's great. The catchphrase for this event is be considered part of the solution. What does that mean to you?
Everybody needs to come to the table.
Right.
And we absolutely want to be part of the solution. The problem is that we have 26 million people living with diabetes. We have 79 million people living with pre-diabetes. It's a huge problem. There is no one group that's going to solve it. That being said, there are solutions, and we want to be part of that solution. We know what prevents diabetes. So we want to bring our capabilities, our manpower, our hopes to the table with our partners and to begin to execute on some of those solutions.
Right, and that kind of leads into the next question about Dennis Urbaniak from Sanofi saying that we're here as collaborators and not as individual constituencies. So that being said, do you think that teamwork will work as well as competition?
It'll work better. And it has to work better. I think, with collaboration will come just more opportunities for all of us.
Right.
It's a big pie. And nobody will get anywhere by just being purely competitive. It's sort of like open source architecture and technology. When you have open source or when you cloud source a problem, you get millions of responses and lots of answers.
Right.
So if you look at United Health Group, for example, over the last 3 years, we've actively collaborated with CDC, with the YMCA, with retail pharmacies, groups that historically we did not collaborate. We certainly worked with, but I wouldn't say in this kind of all-out effort. And the fruits have been just amazing, both from a access perspective, from an affordability perspective, and from an outcomes perspective.
And the final question is, I'm going to ask you to put these into order. Technology and patient healthcare, patient-provider relationship and interaction, and community-based healthcare solutions.
Well, in the spirit of collaboration, I think this is what it does. I think that there's different times and at different places where each of these will be on top, but they're going to keep moving.
That's
Whether
true.
it's with, again, diabetes prevention or diabetes control, we know, this one I'll just pick first, that absolutely the clinician or the provider is we still need that clinical expertise to help drive the clinical management. That being said, people live in communities. So how are you going to execute this management plan if your community doesn't support you? We know that, particularly living with diabetes, that healthcare happens every day, everywhere. It's hard. We have to make it easier, and certainly technology can help make it easier. So I think it's going to depend on day to day, the decisions, the problem, and these are constantly moving, collaborating issues.
Got it. Well, thank you.
Yes, thank you.
Thanks for joining 5 Spot.